G'day, how you going?
Okay, so I've seen you 3 times now. What's going on with the foot? How's the walking?
It's still unsteady, but I am trying to push off with my toes more.
Is there any improvement whatsoever?
A little
honestly?
bit of loosening, yeah.
Okay, so you feel like walking is a fraction improved. Okay, and you're trying to walk more normally, because when I first saw you, which was last week, you had a very stiff gait, kind of like there was no real toe off. It was just like as if your ankle was just held in one position and you're just having it lifted off like that, not getting any of that nice sort of heel to toe movement. But you feel like that's coming back somewhat.
A little bit, yeah.
And that's your honest answer, yes?
Yeah.
Like not influenced by me.
No.
Okay, that's good.
But since you told me to push through my toes more, I am trying to do that.
It's a bit sore.
No, but I am trying to really use my toes more rather than...
And how is it though? Because it's...
And it hurts,
through your
and
big
it's
toe.
tiring, but I still feel like I can do it, rather than before I was like really stiff and my toe wasn't moving at all, really.
And we've been doing a few things on you, graston technique, dry needling, active release technique, general massage and adjusting.
Laser.
Oh, the cold laser, of course, yep. Of all of those, what do you think is helping the most? Because it's probably hard for you to know
Probably
exactly.
the massage, I think it's, when you're getting in really close to the scar, I can sort of feel that's improving the blood flow. And when I touch my foot now, I can feel more
sensation,
live and life in
more
there.
feedback. Well, that's good for me to know, because whatever benefit you're getting from what I'm doing, we want to capitalise on that, right? Okay, well let's keep going as we have been. Okay. Joe, can you slide down towards me a bit, please, just so your ankle's hanging off the edge of the bench. Thanks.
Is that alright, or further?
Just a touch more if you can, So maybe while I'm working away here, can you just tell us how this came about? Because we can all see this scar here on your foot. People wanting to know, how did that happen?
Okay, I was cooking in a very tired mindset. I had a fair bit of stuff happen in my life, and I was just a bit in shock and distracted, and I lifted up a chopping board with a very heavy knife on it that I just used to cut up some ingredients, and as I lifted the chopping board, the knife slid off and then landed in my foot and then bounced back out. And I saw straight away that it was an arterial bleed, because the blood was bright red and it was gushing and it had a pulse, and I thought, I've got to stop it because I don't have a lot of time. So I just stayed very calm and put my thumb in the hole and tried to sort of make the artery spasm and stop bleeding, but it wouldn't. It sort of slowed down, but it didn't stop. So I had to call out to someone to come, because I was by myself and there was just blood everywhere. And then I eventually got a cloth nappy and wrapped it around and sort of used it as a tourniquet to try to stop the bleeding. And the blood just kept coming, so my son called an ambulance. They stitched me up at hospital and told me to have some x-rays, which I didn't think were necessary, but I did it anyway. And then they called me 3 days later to say that I had a couple of broken toes, which I knew about anyway. And they told me to come in and see the orthopaedic surgeons about that. So I went to my mum's funeral and then took my boot off, and then realised my toe had dropped underneath my foot and there was something seriously wrong. And so when I went to the orthopaedic surgeons, I mentioned that, and they got a bit of a shock and brought me straight into surgery. Like instantly, I was put in a wheelchair, wheeled straight down to the pre-op unit and operated on that like an hour and a half later. And they noticed that 2 tendons had been severed, one completely and it had retracted up my leg, and the other one was hanging by a string, but it was as good as severed.
And this is extensor hallicus longus and extensor hallicus brevis, yes?
Yeah.
So in other words, the two tendons that attach into the big toe, and they extend the big toe.
Yes.
Like that.
Yeah.
So having a quick look at Jo's gait here, we can see through her left foot the big toe has difficulty extending, which is why her stride through the left is quite short. You can see both of her steps really are quite abbreviated. A normal person would have a lengthier stride. Here we can see a bit more clearly how the left big toe has an inability to extend and very little power. Okay, because the scar's way up here, but it's affected tendons that are down there, yes?
Yeah.
Because this is where they access that, and also where the knife...
up my leg, so now I came to that night in a cast. Do you want me to keep going, or?
Well, I think we've got the gist of it. Basically, a knife landed in your foot, severing some tendons, and that's why you're here. And it didn't help the fact that there was other stuff going on in your life.
Also, the DVT made the swelling far worse, which then stopped my foot getting better for a long time.
Right, and because of the obvious musculoskeletal trauma, your walking has suffered. Because you can't walk when your tendons are severed, and the objective now is to try and restore range of motion, reduce stiffness, and encourage more healing around this scar, which is very prominent, isn't it? So what I've been doing here is just some sort of preliminary massage, a mix of ART and I guess just improvised massage. Moving Jo's foot, it does feel quite stiff compared to the other one, although now that it's warm it is feeling a little better. I just noticed when we push the ankle into dorsiflexion there is some resistance, probably because there still is fluid in through here. So sometimes you can do mobilisations like this, just where you use your body weight, lean into the patient, and at the same time I'm sort of strangling the ankle here, trying to guide any fluid that's trapped around the ankle and the foot back into the lymphatics. I don't know how much this helps, to be honest. It's, we can't gauge it other than to ask the patient at the end and say, do you feel more mobile through this foot? But biomechanically it makes sense to me to do this. And it is, simply put, a mobilisation of the ankle into dorsiflexion. Then we're going to do some graston technique. Now this scar is still pretty new in the scheme of things. The injury occurred in April, didn't it, Jo?
Yeah.
So, this isn't even a year old. So I don't want to go too hard over this scar. That would just be really uncomfortable. But I'm just going to go along the borders of the scar. As we were talking to Jo at the start of the session, she said that some of this soft tissue work around the scar has really felt like it's helped. I'm on a lot of bony parts of the foot here, so some of this work may not be beneficial as far as the tendons go, but it's also about getting some flexibility through the skin, because the skin needs to be able to move, otherwise the tendons underneath, they're not going to move in unison. That's okay, Jo? Out of 10, how sensitive is this?
It's not too bad. It's probably like 4.
Which is what, about a 9 on everyone else? Is that right?
Probably, yeah.
So pretty hardcore.
When you do is it the graston?
Yeah.
Yeah, when you do that on the calf, It does make my calf feel looser, but then my knee gets quite sore that night.
Okay.
Seems to affect the knee.
Yeah. Well, we'll certainly be changing the way you load your body when we do that. You know, when we make a change in one part of the body, you'll feel it somewhere else.
Yeah.
I'm just going to go lightly over this scar. Is it sensitive?
No, it's sort of quite numb. Don't really feel that much. When you touch that area, I feel pins and needles referring elsewhere,
Okay.
which is probably a good sign that more blood flow or something.
Yeah, well, it's just it's stimulation, isn't it? You know, we can stimulate the tissues by massaging, scraping, needling, lasering, mobilizing, adjusting, all these different inputs to the body. They're all worthwhile doing. If you go to the gym and you're going to do a chest workout, you don't just do bench press, do you? You do flat bench, incline bench, decline bench, flies, push-ups, you know, a whole host of different things. That's what we try and do in physical therapy, is mix up all the different stimuli to try and achieve a result. One more. Well done. That was pretty good. You okay with that?
Yeah.
Yeah, I just mobilised this big toe here. We got a big release last time I did this on you earlier in the week. So as I'm sort of bringing it out, I've gone blank here. The first toe joint, where it is. Metatarso joint. Blank. This is okay, is it?
Yeah.
We are going to needle this again today as well, but not before I've had a look at the calf. So let's turn you over now. I'll get you face down and we're going to move on to the calf. Okay, onto the calf now. We're going to warm it up with good old GT1. Okay, Joe, you okay there?
Yeah.
Now, out of 10, how uncomfortable is this?
Down to 7.
Ooh, okay, we're up there, hey?
Yeah.
You alright?
Yeah.
I don't usually like to operate above 7, so if it gets to 8, tell me, okay? You're not allowed to go to that happy place where you ignore the 9 and 10 out of 10, alright? Still okay?
Yeah.
Where's the most sensitive spot on you?
Right there.
Yeah. And what does this feel like to you?
Like a deep ache.
The feeling of this instrument being run across your leg, does it feel like scraping or?
No, just like a deep muscular ache inside.
Okay. All right, I'm just going to change to the next tool here. With graston technique, you can start doing active releases, so I can be scraping in this direction whilst dorsiflexing the ankle. in this case it requires me using separate hands to do this. I prefer to sort of use two hands and dorsiflex using my body, but it's just a bit difficult. I need to get the calf into a shortened state and then a lengthened state. I need my hand here to do that. But what it then means is I have to be all on my own through the left hand, applying pressure. Typically I prefer to, use both hands. Just let that rest there, Joe. And now that muscle is completely relaxed and I can guide the instrument using both hands. Does this feel better on you when I do it like this, as opposed to me going like that? Or does it just feel like two different techniques?
Yeah, it feels a bit more painful this way.
Yeah. Does it feel more therapeutic or potentially more beneficial, or difficult for you to say?
It does feel like you're doing more because it involves the foot.
Yeah. Yeah, I do like to, seeing as with that previous tool, I'd already butted up the calf. It's good to then go in with this smaller tool and do the active release. And what I then do is I actually back it up with an active release. So here I feel, with my hands, I feel much more capable using my body, reinforcing with the hand. How does this one feel?
Yeah, better than the tool.
Yeah. Bit more bearable.
Yeah.
I do like using my hands because I get maximum feedback through my fingers. This is why when I was studying, I didn't want to learn the graston technique until I'd done at least 5 years of practice, because I wanted to develop the skill of feeling tissue through my hands. I don't usually like having something between the patient and me, but at this point in my career, using the tools is a good idea. Okay. All right, Joe, so we're going to move on to the needles now, okay?
Yep.
You okay there, Joe?
Yeah.
Okay, just coming into the plantar fascia here. All good with these?
Yep.
Just one more through here, okay?
Mm-hmm.
I want to try and loosen up the plantar fascia as well, because that's going to assist in her gait as well.
So what's the involvement of the calf?
Well, because you've been sort of limping and not walking normally, my concern is that this calf is going to stiffen up, and without loosening off the calf, I don't think we can hope to restore your gait to normal pattern.
also having the cast on for so long.
Exactly, yeah, it's just basically just a stiff leg, so we have to look outside the foot.
Yeah.
Well, maybe you should, just in case. Are you ready? Because we're needing to get into your calf here, Joe, I've got you face down. It's much easier for me to pin the calf that way. But getting into these tendons of the big toe is just a little bit more challenging because you're face down, but we can still do it. Okay, there we go. Okay, so moving on to the cold laser treatment, because this is a lower limb injury, we're going to laser just in the lower back. This is where all the nerves come out that eventually supply the foot. So we'll do about 6 spots. We'll do 1, 2, 3, 4, 5, 6. These are 30-second bursts at continuous frequency. This is for pain inhibition. Okay. Okay, so we're going to adjust you now. I'll get you to lie on your right side, just facing the wall over there. We're going to adjust you, Joe, because for the same reason that your calf has become stiff, I feel like your back has become stiff somewhat.
Just in there is very bad.
Yeah, but we'll adjust there as well. We just want to hit the key spots and make sure that all the main parts of your body are moving to the best of their ability. Obviously the focus is on the foot, secondary focus on the calf, and then tertiary focus on the spine, yeah. Okay, breathe in for me, and breathe out. Okay, nice and floppy here for me. Gotcha, well done. Just lie, sorry, I'll get you sitting now only this way. That moved pretty nicely, didn't it?
Yeah.
Okay. Just give yourself a hug there. That's it. Drop your chin to your chest for me, please. Breathe in for me. Breathe out. You okay here?
Mm-hmm.
There we go. Oh, wow.
That's a big one.
I'm a bit envious of that. That was good. Okay. So let's get you to stand up, and we're going to test this walking with you now. Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate. Good on you.